And in the meantime, of course, invite Mitre to the podium, because she will be the next speaker, presenting on data from the SAFE-ICU study on fungal exposure in intensive care units. Please, Patty.
Thank you. So I will be presenting on PK/PD target attainment with contemporary dosing of antifungal drugs. These are the outcomes of the screening antifungal exposure in intensive care units, the SAFE-ICU study. Fungal infections are increasingly common, potentially devastating nosocomial infections. For critically ill patients in particular, these infections are associated with substantial mortality and morbidity rates. In this patient population, other pharmacokinetics decrease the likelihood that standard dosing regimens will achieve maximally effective drug exposures. Factors such as organ dysfunction, fluid shifts, and concomitant medications lead to difficult to predict drug exposures and potentially impaired therapeutic responses. Also, usable real-time monitoring of patient responses to treatment is challenging given the coarse nature of infection symptoms. And therefore, the quality of dosing is defined by the achievement of target drug exposures that are associated with improved patient outcomes. Now, the existing pharmacokinetic data on antifungals in critically ill patients are mostly derived from small single-center studies with limited capacity to inform the development of robust dosing recommendations. And large multi-center studies such as DALI provided valuable insights into antibacterial PK in the critically ill, but had sparse antifungal data. And so the SAFE-ICU study was designed after recognizing the need for more comprehensive data on antifungal PK in a multinational cross-section of ICUs. The objective of the SAFE-ICU study was to describe whether contemporary dosing of antifungals achieve therapeutic exposures in critically ill patients that are associated with optimal outcomes. This was a prospective open-label multicenter PK study in adult ICUs where critically ill patients were enrolled according to predefined inclusion and exclusion criteria. Azole, echinocandin, and polyN antifungals were studied, and the choice of antifungal and agent and dosing were at the discretion of the treating clinician. Now, PK sampling occurred on two occasions. Firstly, during a dosing interval between the first and third days of antifungal course in the ICU, and secondly, during a dosing interval between the fourth and seventh days. On each sample occasion, 3 blood samples were drawn from established intravenous access. Sample A was collected 30 minutes after the completion of the infusion or the enteral dose was administered. Sample B was taken between 3 and 6 hours after the start of the drug infusion, and then sample C was collected within 30 minutes before the next scheduled dose. Total concentrations of the study antifungals in plasma were determined by validated chromatographic methods at the University of Queensland Centre for Clinical Research. To assess target attainment, the MIC of the identified fungi was used. If not available, the MIC was defined by the UCAST epidemiologic cutoff values, and where no fungi was identified, the highest MIC for susceptible species to the antifungal was assumed for a worst-case scenario. The area under the curve from 0 to 24 hours was estimated by non-compartmental analysis in Phoenix with Nunlin, and concentrations from samples A and C were considered as Cmax and Cmin, respectively. In total, 339 patients were included from 30 ICUs across 12 countries. Antifungal therapy was primarily prescribed for treatment. Fluconazole was the most frequently prescribed antifungal. Fungi were identified in 54% of patients prescribed treatment, and 8% patients prescribed prophylaxis, with Candida albicans, Candida glabrata, and Candida parapsilosis being the most prevalent. Only nearly 26% of the fungi identified had an MIC available. And by day 30 following the study enrollment, nearly 40% of patients receiving antifungal therapy had died, of which 88% of them were receiving antifungal treatment. 9 patients were prescribed the second antifungal, and 1 received the third antifungal, and therefore 349 antifungal regimens were sampled and evaluated. 99% of them were sampled on occasion 1, of which 30% were commenced in the 24 hours before the first sample collection. Only 67% of courses were sampled on occasion 2, and a total of 579 courses were sampled. Target attainment could not be determined for 46 courses due to insufficient sampling to estimate the area under the curve or inappropriate sample timing. Okay, so this is a large table which is displaying the number of courses evaluated, the mean daily and weight-based daily doses of the study antifungals, and data describing the PK/PD target attainment. There is a lot to digest, but due to time constraints, I will summarize the most important findings, which are that generally target attainment was higher for patients receiving prophylaxis, with most drugs having more than 80% of those patients attaining target drug exposures, and that low target attainment was noted for voriconazole, posaconazole, micafungin, and amphotericin B in particular. Now, this study represents the first large-scale international prospective investigation into PK/PD target attainment and dosing adequacy of antifungal agents across a large number of ICUs. The findings revealed that on occasion one, more than 25% of patients did not meet the predefined target exposures. And voriconazole, posaconazole, micafungin, and amphotericin B were among the antifungal agents with the lowest target attainment. This suggests that contemporary dosing regimens of these antifungal agents may not effectively achieve optimal therapeutic exposure necessary for combating or preventing fungal infections in adult critically ill patients. These observations underscore the need for better dosing regimens to achieve optimal exposures in the ICU, given that the current doses prescribed for treatment are considered standard and do not account for important PK variations in critically ill patients, likely leading to suboptimal exposures. In conclusion, this international multicenter PK study highlights the varying degrees of target attainment observed across different antifungal agents in critically ill patients. And while a significant proportion of patients achieve the predefined targets, wide variability and subtherapeutic exposures persist. Thank you.
Thank you. That was wonderful. Really a lot of information there, and I'm sure we'll see much more coming out of that data set.